Welcome back to Inside South Florida. We all know the aorta is important, but what the heck does it really do? Well, here to tell us all about it and to keep us heart healthy and safe is Dr. Ali Shahriari. All right, Dr. Shahriari, welcome to the show. How are you?
Thank you very much. Very well. How are you?
I'm great. I'm great. You know, you and I were just bonding over some sports before we started this thing. You know, the soccer, the World Cup, which can make your heart sort of race.
It can make it race, yes.
Which is a nice segue for what we're going to talk about.
Exactly.
Specifically the aorta. Everybody knows they've got one and kind of sort of knows what it does, but you know, specifically, what is the purpose of the aorta?
Great. Thank you for the question, and thank you for having us here today. So the aorta is really the largest blood vessel in the body. It's the highway of life, pretty much. It starts at the level of the heart, where the aortic valve opens and directs the blood only in one direction, which is towards the brain and the body. And it comes up, goes through the chest, feeds the brain, the arms, comes back down through the back of the chest, feeds the spinal cord, and then it goes down and feeds the liver, kidney, gut, stomach, and all the visceral organs, important organs, and then down to the legs and feeds the legs. So any blockage in this, which I call glorified plumbing really, can cause problems. That's why it's a significant vessel. It also feeds blood vessel to the heart. So if you have a blockage there, you can get a heart attack. If you have a blockage from the aorta coming to the brain, it can cause a stroke. If you have a blockage to the kidneys, it can cause a kidney infarction, and so forth and so on. And the diseases of the aorta are so common that about 1 out of 12 cardiovascular related deaths in the country is related to the death from the aorta. So it's a very important function.
I didn't go to med school, but based on what you just said, it sounds important.
It's very important.
It sounds like it's controlling everything that's going on.
It does, yes.
Yeah. All right, so you just gave the numbers of how many people might be affected by this. I would imagine oftentimes people probably have a problem before they know they have a problem. Is that accurate?
That is accurate, yes.
Yeah. Is there anything that people can do to sort of be on the lookout symptom-wise that they might have a problem with their aorta?
The problem with aortic disease is the most common disease of the aorta is what we call an aneurysm. And an aneurysm is basically a weakening in the wall, where if you think of a regular nice plumbing in your house, the wall gets, like a hose in your backyard, the wall gets weakened and the hose starts expanding. It's the same thing with the aorta. The layers get weaker and it starts expanding like a ball. And after a while, it ruptures. During this expansion phase, there is really many people, most people don't have any symptoms. And that's why we call the aortic aneurysm a silent killer. And the reason is, until they are ready to burst, you have no symptoms. So the way we take care of these type of things is by being active, screening patients. About 10 to 20% of patients with aneurysms have a genetic factor. So paying attention to your family members and what diseases they have is very important. Paying attention to other genetic diseases is important. And also screening programs that we have in place, for example, at Florida Medical Center, is very, very important, that patients that have risk factors, namely smokers, people that have high blood pressure, people that have high cholesterol levels, and people who have a genetic factor for this problem, and also if you have heart disease, coronary disease, are at risk. They can come and get screened with a non-invasive, very painless type of test with an ultrasound. And you,
in the notes here, it says that you have these screenings quarterly, right?
We do have them quarterly, but if we have enough people that have interest in this, you know, we are, you know, more than willing to accommodate and set extra ones, which we have done in the past.
Okay, and I know that one of the solutions is a new valve. What are some of the other surgical and non-surgical things that you can do if somebody does present aortic disease?
So if you have an aortic disease, it all depends on where in the aorta the problem is. So we happen to be very lucky at Florida Medical Center. We have a lot of support from our healthcare system, you know, with Tenet and Florida Medical Center administration. So we have a very unique program where one team takes care of the entire aorta. It doesn't matter where the problem is. So if you have, let's say, an aortic aneurysm above the heart, our team goes in and can fix it with an open repair. The same doctor. So there's really no bias in what the patient needs. If you have an aneurysm that starts from what we call the arch, where the blood vessels to the brain come off and all the way down, most often we treat those through the groin nowadays. Mm-hmm. For example, just recently we treated a patient who had been done 3 times in the past, 3 operations. He's 62 years old. All 3 had failed. And we went in and repaired him over 6 hours in the hospital. He was in the hospital 2 days and went home with a repaired aorta.
Wow.
And that is the benefit of really being a super specialist and specializing and identifying the true problems that you have to go after.
So it's just like the game Operation. Just a
Just
tiny
like
little steady
it.
hand.
It's just like it.
That's all you need.
Absolutely.
Just be good at operation.
It's very much like sports, and it's you know, I love sports as
Right.
you know. And it's like, you know, many people spend years of their lives figuring out how to do that scissor kick or do the dunk.
Right.
But when you look at brilliant players, they don't, that's not what their focus is. Their focus is on that one fine, clean pass that opens up the whole field. And this is very, very similar. You're not looking for complex, challenging ways of standing on your head doing things. You're looking for simple solutions that take care of complex problems.
Fair to say you are the Pele of aorta surgery.
I wouldn't go that far, but maybe the Maradona. No, I'm just kidding.
Nothing wrong with that. Nothing wrong with that. So great to see you. Before we go, give us a website address or some way that people can get a hold of you and find out more.
Absolutely. So we have a Aortic Disease Institute. So if you Google simply Florida Aortic Disease Institute at Florida Medical Center, you will find us there. There's a website there, some information about what we do, some patient testimonials, histories, people, and interesting stuff to read. So if you're in need of getting in touch with us or getting a screening done, you can always also go to fmc-campus.com. So if you really need to get in touch with us and discuss or set up an appointment, you can always call 866-498-LIFE.
You had all that information on the top of your head. Well done.
It just runs out of my tongue.
Just comes out there. Dr. Shahriari, good to see you.
Hey, great meeting you.
All right,
Thank
take
you.
care. Yep.
Thank you.